Can you hear me now?
Yes, we can hear you.
Okay, great. Thanks very much. The clerk does a roll call. I'm calling to order the Riviera Beach City Council Community Teleconference on December 3rd. The time is 6 o'clock. Madam Clerk, please call the roll. I'm not hearing anything. Marion?
Yes.
I'm not hearing. Oh, there's a lot of echo on your phone, like heavy echo.
I don't know what to say. I'm just,
It's almost impossible to understand what you're saying. Do you have a speaker on that is feeding back, or?
Is this any better now?
Only
No.
Slightly better. Now the echo is a little less loud, but I don't know what to say. Jonathan, can you hear the echo on her phone?
Is this any better?
Yes.
Hello? That's
Yes.
better?
Yes.
Can everybody else hear me?
Yes.
Okay. Do we have a clerk who's going to call the roll?
I didn't see her name on the list of attendees, so I don't.
Oh, okay. It's listed on the agenda. It's on the agenda. So, well,
Oh,
you know what?
okay.
Why don't you call the roll?
I don't have the full list. Well.
Mayor Felder, are you with us? I can do it. Chair Pro Tem Lawson. Chair Kashamba Miller Anderson. Councilman McCoy. Councilwoman Lanier. Thank you. I'll hand it to you, Ms. Dozier.
All righty. Thank you so much, Councilwoman Botel. And it is me, Marion Dozier, the Senior Multimedia Specialist here at the Center. And I will be acting as the moderator this evening in place of Marcia Noel, who is busy somewhere else. But we will be talking about primarily updates to the COVID-19 operations that are happening here in the city. And we have a full list of speakers who are going to inform us all. And the first one who is going to speak is our city manager, Jonathan Evans, who is going to provide the introduction. Mr. Evans? Hello? Can anyone hear me?
Yes.
Mr. Evans? Did you want to go ahead and do the introduction to the meeting, Mr. Evans? Hello?
You're not alone, but I'm not hearing him.
I guess Mr. Evans isn't here? He's not on the call?
He was on the call.
Okay. Well, until Mr. Evans returns, is Fire Chief John Curd on the call?
Yes, I'm here.
Okay. Fire Chief Curd, could you go ahead then and provide the operational and situational updates since Mr. Evans is not on the call right at this moment?
Absolutely. I'd be more than happy to start off. I'm going to go ahead and situational update on COVID-19, some of the things that the city is doing, and what it's going to look like for us here over the next month or two. We've had a very busy week as it relates to COVID. Just yesterday alone, the U.S. saw over 200,000 new cases and broke a record for the number of deaths recorded in one day. We lost 2,885 people yesterday in the United States as it relates to COVID. As we bring it in closer to the state of Florida, we are now at 1,029,030 total cases. We have seen 19,112 deaths. In Palm Beach County, we have seen 67,106 total cases of COVID and 1,709 deaths. There are many metrics that we're looking at to determine how active the virus is, not only in the U.S., the state, but more importantly, within our area in Palm Beach County, Riviera Beach. In the state of Florida, there have been positivity rates that have ranged anywhere from, and these are the daily rates, from 8% to 15%. Yesterday, they were at 9.1%. Palm Beach County was at 7.96%. If you all recall, through multiple conversations we've had about daily percentage rates and the effectiveness of contact tracing, 5% is a threshold where contact tracing no longer becomes possible when you're above 5%. And once you receive a 10% threshold mark, or once you've exceeded that, the virus is deemed to be considered community spread. So we have passed the 5% threshold. We are nearing the 10% threshold, and we are seeing numbers go up in every category. More particularly in Riviera Beach, I monitor the census tract data that breaks our community up into different geographic zones. While some of them bleed over into other municipalities, it does give us a good sense of what's happening in our community. And while there have been some fluctuations of positivity rates throughout different portions of our community, the general trend is that we are trending up throughout our community. And this is from the ocean to Military Trail out west and everywhere in between.
As it relates in what sense, Chief? I'm sorry. Go ahead.
No, go ahead.
In what sense is it trending? Are the numbers trending up? What do you mean?
Well, it's a long discussion that we've had over some time, but there's a matrix for census information. It's called census tract data. If you look up, and most of the individuals, we'd originally gone over and emailed out maps of our city and what those zones are. So you can look at the specific numbers. There's about 15 zones within Riviera Beach that are considered census tract, the census tracts, and it's actually used for the census. So that's how we break our municipality up into smaller bite-sized portions so we can see what the virus is doing in the community. They are trending up in every one of the census tract areas, meaning the number of active cases are going up from where we were to just maybe one or two throughout the community a month and a half, 2 months ago, to well over 50 or 60 active cases going on in the community. If you'd like, I'd send you over that census tract information so you can have a better look at it. There is a lot of stress.
I would like to see that. I would like to see that, Chief. And then, so you're saying that currently here in the city, in those 15 zones in the city of Riviera Beach, we have 50 to 60 active cases currently?
Yeah, we have thousands of active cases right now in Palm Beach County. While we do well in our community, considering we're seeing in the south part of the county, Delray, Boynton Beach, Lake Worth, West Palm Beach have some very, very difficult numbers. Even out west in the Pahokee, Belle Glade area, we see astronomical numbers. While 50 to 60 may seem surprising to some people, those are actually respectable numbers when you look at it in relation to what's happening in Palm Beach County.
Okay.
So if you want to email me, I'll get you that. I want to talk a little bit about some of the testing. There's been a lot of stress and strain as of late being put on labs and testing centers due to the increase in the number of COVID cases, which is resulting in individuals getting their results late. We are going to continue to see the increase in the number of people getting tested, so there will be delayed results. Within Riviera Beach, we have worked with United Labs to ensure that our employees' turnaround times are within 48 to 72 hours, so we can see what's going on with them, quarantine if need be, or get them back to work as soon as possible. But with this holiday season, the people that work at the labs get the holidays off as well, so they end up falling behind. Then it becomes very difficult for them to catch up. So you can anticipate that if you are going to be looking to get a test, you may want to do it in advance, because the typical 48 to 72 hour turnaround that we saw 3 months ago is no longer the standard. Palm Beach County Health Department has warned of a surge within a surge. That's what we're getting ready to go through right now over the holiday season. We've seen a steady increase in the number of cases through October. We saw a spike after Halloween. We are now seeing another spike after Thanksgiving. We haven't yet seen where that spike is going to level off at, and we know we're going to see additional spikes throughout the holidays, as there are many holiday gatherings, get-togethers, dinners, New Year's Eve parties, and the like. So we are anticipating a very significant surge, and I just can't stress enough the importance of all of the things we've talked about for the last 9 months. I know we're all dealing with COVID fatigue, but the facial coverings, the hand sanitizing, the physical distancing, you're going to hear me keep saying it over and over. I hope that we understand the importance of adhering to these guidelines. And my goal is, and I know you're tired of hearing it, but my goal is to try to save a life. And if I can get people to comply, hopefully I will have achieved my mission in keeping our community safe. The CDC has put out some recommendations on canceling travel plans and gatherings. This is what's being considered a dark winter. And while it's unfortunate, this should be a time of family and joy. I think right now health is paramount. And the CDC has asked the general public to cancel any travel plans that they may have had and look to minimize or completely eliminate these large gatherings. Palm Beach County Health Department has urged municipalities to please cancel or minimize holiday gatherings, get-together, events, festivities. They are seeing a lot of municipalities kind of going back to normal business, and with the surge that we're seeing and what we're expecting to see over the next 30 to 60 days, we're going to have to roll back on our own to protect our community. So it is going to be a difficult winter, but cases, one of the biggest concerns that we are having is we are seeing reports of people being reinfected. And these are documented cases. This is not rumor. These are individuals that were tracked. They tested positive. They spent their 14 days going through COVID, subsequently tested negative, and they even had a positive antibody test. 4 to 6 months after their original infection, they've developed symptoms again. They are negative for the antibody, but they are testing positive for the virus. So it goes to show, and we don't know if these are isolated cases. We don't yet have enough data. This is still a new virus. We are seeing individuals basically get the virus, develop the antibody, but the body not be able to maintain the antibody, and people are becoming reinfected. So I say that to urge our community to make sure that don't fall into the trap of, I've already had COVID, I can't get it again. So please be mindful of that. There have been an expressed concern about the ability to maintain antibodies, and currently, while I said these are isolated cases, this is something that we're going to be watching a little bit closer and see how that applies to the vaccine and what the vaccine is going to do for us developing the antibodies. Talking about the vaccine, this seems to be one of the big topics of conversation here over the last week. The Moderna and Pfizer Corporation have both submitted to the FDA approval for emergency use authorization. Pfizer is expected to receive their approval next week. Actually, on December 10th, they go to public hearing, and 48 to 72 hours after public hearing, they are normally expected, or it's normally expected that they would receive their EUA, their emergency use authorization. Moderna goes to public hearing 12/17. So we do have two manufacturers that are looking to receive emergency use authorization. Once that is done by the FDA, the CDC will then determine priorities for who gets the vaccine first, and they're going to be using out a phased rollout plan. One of the concerns that I have is the UK has given Pfizer emergency use authorization, and many of the vaccines that were manufactured and being held and housed here in the United States are now being shipped to Europe. So understand that, and please don't fall into the trap of, you hear there's 40 million doses, there's 60 million, 100 million. This is not just for the United States or worldwide. So these vaccines are being produced for the entire world, and 40 million isn't quite as many as you think it is when you're talking about the world's population. In the phased rollout, phase 1A of the distribution, is anticipated that healthcare workers and senior population, those living in ALFs and nursing homes, will be given priority on the vaccine. The vaccine is not expected to be widely available to the general public until April or May. So please don't fall into the false sense of security that the vaccine is on its way, that this is over. We will go through the winter and early spring without a vaccine available to the general public, and it won't be until late spring, early summer until the vaccine is widely available. Riviera Beach had completed its closed point of distribution plan. Originally, it was anticipated that municipalities were going to be able to distribute and actually provide the vaccines to their community members, but it looks like they're changing their model, and instead of using a closed pod program, they're going to be utilizing more of what's known as an open pod, where it appears that the federal government is going to be working with facilities like CVS and Walgreens to distribute the vaccine as they would the flu shot. And part of the reasoning for this is the volatility and sensitivity of some of these vaccines have to be kept at negative 94 degrees. We're talking about cryogenic type temperatures that a lot of facilities can't handle or maintain the quantities needed. So when the vaccine does roll out into the state of Florida, there are 5 hospitals in Palm Beach County that can store that vaccine in the quantities needed. And there will be individuals that will be guiding the process of who gets the vaccine, when they get the vaccine, and how the vaccine is distributed. And I can assure you that we'll be on top of that. And as soon as it's available for our healthcare workers and the seniors within our community, we will make that information known and make sure we get it out on all platforms so that none of our seniors miss out, as that's the most vulnerable population simply due to the death rate of that age group, 65 and older. So we're going to continue to monitor it on this end. I plead and implore to our community, to our council, to reach out to the constituents within their areas and please have them adhere to these guidelines. Also, we need you all as our elected officials to set the example. There's been many events and gatherings that have gone on, and people have now seen that, you know, things were getting back to normal. And that may have been the case in June, July, August, and even in September. But now that we're moving into this holiday season, we want to do everything in our possible, everything possible to avoid a super spreader event within our community that is such an at-risk and vulnerable community. And I'd hate to see all the good work we've done in our community go to waste here on the back half of this pandemic. So please stay safe, enjoy the holidays, but do it responsibly, do it safe. And I turn it back over to you, Ms. Dozier.
All right, great report, sir. I appreciate it. Does anybody have any questions for Chief Clarence? All right, and from what I am understanding, our city manager, Jonathan Evans, is now on the call.
Yes, I am. Thank you, Ms. Dozier.
Yes, and now we would like to hear your opening remarks, Mr. Evans. Thank you.
Again, thank you, everybody, for being on the call, and certainly the elected officials for your leadership during this pandemic. Some of the things that we have been doing in light of the increased numbers is staff has been working to put together an operational plan that looks to move back to our Alpha Bravo Charlie situations where we have limited office hours and limited number of persons in facilities. We are still making sure that there is no impact to service delivery and the models that we put forth. So we are working on developing that policy and being able to roll that out as early as the first part of next week. Risk management and legal have been working in collaboration with human resources to put forth a plan that can address the health, safety, and welfare of our employees, as well as making sure the operational impacts to the public is de minimis. Some of the things that we have talked about is staggered scheduling, whereby an individual may come in to work at 7 and others may come into work at noon and work their full days, but making sure that there is no opportunities where those persons would cross paths and restricting access to some of the facilities. One of the things we have done early on is continue to restrict access to certain facilities. So if an individual works at the water plant, that's where they go and conduct their business. They are not permitted or allowed to go to other facilities such as public works and the like. So we have done that, and we've been quite successful with ensuring that if there is a situation in the workforce that we can isolate it and address that. We have also implemented a testing strategy. The testing strategy that we deployed prior to Thanksgiving required any persons that was traveling 50 miles or more outside of their normal commute to work, or was having visitors come into town, or them themselves were going out of town, had to submit to testing. And the testing is provided by the partner that we have with United Laboratories. Testing occurs at either their facility, or you can go to the sites that they have here in the city of Riviera Beach, which is Wells Recreation Center. For the general public, those sites are open Monday, Wednesday, Friday. For our employees that tested on Monday, they are required to go back and test again this Friday. The purpose for that is we know that the virus takes a little bit of time in order for the viral load to get to a certain point where it registers a positive result. So we wanted to do that in the abundance of caution, have our employees go twice. They can sign into the portal, they get their results and downloadable, and then they provide that information to human resources. We have also kept in place the contact tracing element for the agency, as well as we call our individuals that are out, whether it's on observation or they are COVID positive, every day, to ensure that they're okay, and if there's anything that the organization can do to assist in facilitating their any activities that they may have or needs that they may have during this particular time. And so we've been very accommodating for those persons that become ill associated with COVID. Another thing, through my connections with the Palm Beach County Managers Association, we are looking at surveying other municipalities to look at what some of the operational changes are and what are some of the things that they are doing with regards to recreational activities, the use of banquet halls and facilities and the like. And that information should be provided to administration in the next week or so, and then we'll take a look at that data. One of the things that I'm sure Chief Curd mentioned as part of his report is that the Emergency Operations Center and the Health Department are continuing to work in tandem, but encouraging folks that if you don't have to travel, please avoid going out of town. Please avoid large crowds. Please avoid situations and circumstances that increase your chances for contracting this virus. We know that the numbers are going to continue to increase. They're increasing at a rate that was far beyond the rate and the numbers that resulted in us shutting our operations down for that time. And so we have to be cognizant of this. We have to be aware of this. And we have to understand that by the time the vaccine makes its way to our entire general public, you're talking about the spring of next year. So there is a long list of persons and individuals and situations that have to occur prior to a point where we get herd immunization or the vaccine is available for all members of the public. We still will continue to advocate and champion the cause to be able to provide it to our residents in our community. And Chief Curd and his team have done an exceptional job with regards to facilitating that. Some of the things that we are doing to expand on some of the feedings that we're doing for the community is we're looking for a more sustainable, more practical option, and we hope to bring something to the board for consideration in the first or second meeting in January. This is consistent with some of the direction that's been provided out of the Health and Human Services Committee under the leadership of Councilperson Lanier with respect to a community garden. So we had a very productive conversations with persons that can assist in facilitating and getting something that is far more robust and can provide thousands upon thousands of pounds of fresh produce to our community. We know that the demand for food in our community is continuing to grow. We are going to continue to provide that service, working with Feeding South Florida for as long as we can. We're getting to a point now where there is almost a situation whereby persons that would queue up in the line to receive food from our food distribution center, we're only having enough to be able to sometimes make it through the line. And so we know there is persons that are calling and inquiring. We're going to try to help as many people as we can with the resources we have, but certainly we're asking the community to please be patient with us, to allow for us to try to find and source additional resources to accommodate what the needs may be, but we want to make sure that these meals get to our community and get to the needy as quickly as possible. And so we're going to continue to provide that service. Again, I cannot emphasize enough the importance of staying safe, making sure you're wearing your facial coverings, utilizing hand sanitizers. We are going to be looking at some additional mass distribution, whether we do that vis-a-vis our feeding distribution or we look to mail something out. We are going to look at some additional distributions of mass as we know that the numbers are going up. So there may be something that is initiated by the city before Christmas and definitely before the new year, because we want to make sure that our community has the appropriate protective items if they are out. Every person that you interact with, I can't stress this enough, you have to operate under the pretense that they may be a host or a carrier of this particular virus. It is very, very contagious. It is more contagious than a lot of other things that we experience, even influenza in some form or some fashion. So I cannot emphasize enough the importance of just being vigilant and understanding that we are doing everything in our power to keep our numbers low. When you look at some of the communities that have a similar composition with regards to ethnicity, we have outpaced and outperformed all those communities. And that's a testament to the leadership of the elected officials and the support that they have provided to staff, as well as those that are working in all the EOC support positions and the employees that have been doing an exceptional job. We're always going to do what we can to safeguard the employees and provide the services that we can in a way that is responsible. One of the things that you've probably seen is that Governor DeSantis does not believe that taking the steps to provide local jurisdictions the authority to effectively modify business operations and practices is not going to happen. And from his remarks, the issue is that the local businesses and the economic factors that are a result of shutdown are detrimental to the economy and detrimental to Floridians. But we as a city are going to do everything we can in our power to make sure that if you do attend or go anywhere, that you have the appropriate items, whether it's masks or gloves or hand sanitizers. We ask you that if you are in those situations that you need things, please make it a point to contact us. We're here to support and facilitate as much as we possibly can to make sure you and your families are safe. We know that our businesses are a main source of revenue and a main employer in this agency. And so if the businesses need any assistance, we as a city stand prepared to facilitate and assist. But when you do go to those businesses' operations, please make sure that you're very, very careful. And we don't see that there would be any additional restrictions coming down from Tallahassee. We are awaiting for an attorney general opinion. One of the municipalities in the Managers Association is asking for an AGO opinion about, under the home rule authority that's provided in the Florida State Constitution, can a local government, in the event that there is a situation where the elector or the elected officials need to go back to remote meetings for whatever circumstance, that can be provided. Right now, I believe there's a court case concerning that, because some municipalities have utilized it under their emergency order and under their home rule authority. So there is some thoughts and conversations on the manager level about looking at virtual meetings. That's not something that we're moving towards, but we're going to continue to monitor that and see what the outcome of that is. So again, thank you for your continued support to the elected officials and the community. And if there's ever anything that we can do, we stand prepared and willing to assist and facilitate. And you'll hear that from the others in the emergency command staff that will talk about some of the things that we've got going on and some of the things that we've done as a result of this pandemic. And at this time, Ms. Dozier, I turn it back over to you.
And thank you, Mr. Evans, for a wonderful report. Does anyone have any questions for Mr. Evans? All right, and so now we will go to the next speaker, Valerie Grimsley, about Health and Human Services update. Are you on the call?
Yes, I am.
Yay.
Can you hear me?
Yes, I can.
Okay, great. Good evening. This is Valerie Grimsley, YEP Director, Acting Manager, Health and Human Services, Section Chief. I'd like to discuss the food distributions. As you've heard some things about them, but I'd like to talk about them a little bit more in depth. Health and Human Services does continue to partner with Feeding South Florida to provide community food distributions once a week at Wells Recreation. These food distributions are held only on Fridays from 9 to 11. Currently, there are more than 250 families being served every week and actually gaining more every week. Since the inception of the pandemic, there's been more than 15,000 families served during these distributions. Food distributions are expected to continue through January 2021, in spite of the things that we are hearing on Channel 5 and Channel 12 news outlets. We have been confirmed to continue our food distributions through January 2021. In addition to the food distributions, Health and Human Services will begin collaborating with school districts beginning Friday, December 4th, to provide 5-day student meal boxes that will include breakfast and lunch to those students that are engaging in virtual learning. These 5-day meals will be available for pickup on Fridays at Wells Recreation between the hours of 9 and 11. The meal boxes will continue to be distributed to Riviera Beach Youth through the end of December at this time. We are working to see if the need is as great, and if so, we will continue those food distributions for those students through January. Health and Human Services continue to provide grocery box deliveries bi-weekly to 25 senior citizens and or disabled residents within Riviera Beach that do not have transportation to the weekly food distributions held at Wells Recreation. Also, in conjunction with what information was provided by Chief Kurd and City Manager Evans, COVID-19 testing at this time, the city has partnered with United Clinical Laboratories to provide community COVID-19 PCR testing. This testing is by way of the throat for those that may be concerned, which is currently available to the community at large at no cost. These testings are held Monday and Wednesday from 9 to 4 and Fridays from 1 to 5 at Wells Recreation. The estimated turnaround time per the staff is 24 to 48 hours, but could take up to 72 hours just depending on the time, as you've heard from Chief Kurd. The results will be provided by phone, email, and text just in case those that are being tested need something in writing to take back to their employers, their apartment, their landlords, whomever. Those that are looking for that will actually be given something in writing. Testing is expected to continue through the end of December, we have been told, but we're trying to see if, because of the CARES Act, the testing may not be able to continue through January because the test is provided at no cost through the CARES Act. But there's still some things that are working behind the scenes to sort of continue those things. The mass distributions, today the city has distributed more than 50,000 masks to citizens of Riviera Beach. Most recent mass distribution was during the mayor's Thanksgiving holiday, turkey and food distributions held on November 21st and 22nd. There were 1,500 masks distributed during those days. At this time, there are no upcoming mass distributions planned, but as you've heard from the city manager, there will be some form of mass distributions coming in the near future. But in the event that you need masks prior to those events coming forward, please give us a call. And that is your Health and Human Services report. Back to you, Ms. Dozier.
Love that. Thank you so much, Ms. Grimsley. Good report. A lot of masks. I didn't know that. Any questions from the Health and Human Services, Queen?
I have just a comment. This is Councilwoman Botel. I wanted to be sure everyone was aware that the feeding program that Ms. Grimsley and the city were involved with in collaboration with the Friends of the Riviera Beach has been nominated for an award by Nonprofits First. And the award ceremony will be on December 8th. And we're excited about it. We're up against some tough competition, but we looking forward to a positive outcome there, we hope. But it's just an honor to be nominated. And that was in collaboration with Valerie Grimsley, the city staff who helped deliver the food to the children in the beginning of the pandemic. And also the Valley of Hope Ministries was involved. Flippany, which is a USDA food distribution site down south of us. And we're just excited about being nominated. So thank you again to Valerie for the work she did there. Appreciate it.
And is going to be given on December the 8th. That's when we'll find out if the city got.
Yes, that's what we'll find out. Our category is one of collaboration. It's an award given for people who collaborate, charities who collaborated with one. So.
Don't be surprised if Marion the harasser calls you about that Councilwoman Hotel. I'd be interested to learn a little more about that.
I certainly will send you information. Thank you.
Okay, thank you. Right now, time for our finance update from Randy Sherman, our finance director.
Good evening, everyone. This is Randy Sherman, Finance Director. We'll start tonight's discussion on the utility program. Again, a top priority is to obviously keep the water flowing and keep our customers all active and help them financially meet their obligations. Currently, right now, we have 177 accounts that are disconnected. Again, in retrospect, looking back to pre-COVID numbers, those numbers would typically be in the 1,000 to 1,200 numbers. So I think we've done an outstanding job, as have the customers of the utility district. As we, again, look to modify operations and perhaps reduce staffing on an Alpha Bravo rotation, we're trying to, again, encourage our customers to use remote payment methods. We have the lockbox available. We have pay by phone. We have auto pay. We have online payment. So all of these options are available. Now, again, pre-COVID, only about 25% of our customers actually used any of those methods. Right now, just to give you a little perspective, we're only visited by about 60 customers per day. So customers have found these methods and continue to use them. As you know, we limit the number of people in City Hall at any one time standing at our windows. Out of those 60 people that show up on any given day, about half of them are actually just here to use the drop box. So we're getting maybe about 30 people inside, and very rarely do you see more than one person at the window. And again, we limit it to 2 at a time. So I think that has worked real well here. We have also prepared 2 kiosks available for payments. They are actually programmed and ready to go, but they're waiting for the implementation of the new utility billing system in order to go live, and that is scheduled for mid-March at this point. Little bit of sad news. The Palm Beach County Community Services Program, which was one of the big funding sources from the CARES Act through the county, they have terminated their utility assistance program as of 5 o'clock tonight. So without additional federal stimulus funds, that is no longer a resource. So staff is seeking other resources that we will be able to direct our customers to. I did want to also follow up on the CARES Act funding to the city through the county. If you recall, on November 18th, the City Council approved an interlocal agreement with Palm Beach County to provide some reimbursement for some of the out-of-pocket expenses. That evening, we submitted to the City Council a number of $574,000, which included the loan program that we had operated. The county has rejected reimbursing us for the loan program, but our final number that we have submitted is $515,946. So again, that doesn't mean we can't seek those funds through FEMA, but right now this is what we have in front of the county. And that ends the finance report. Back to you, Ms. Dozier.
All right, thank you, sir. Are there any questions for the King of Finance? No. Okay. Sheila? schedule. I don't know if that's Mr. or Miss Shields.
Hello, everyone. As Mr. Evans so eloquently stated, we are in the throes of establishing guidelines to support essential city operations during the pandemic with the intent to protect the health, safety, and welfare of employees, citizens, and visitors to us. We have the granular hopes or the hopes to, come up with a granular operational response to the pandemic, which ensures the safety, sanitation, maintaining communications, setting hours of operations, designating work schedules, identifying priorities, and ensuring the delivery of services. And so that's pretty much what we're working on.
All right.
Back to you, Mr. Bishop. Thank you.
Thank you. And I have just learned that Councilwoman Shirley Lanier is now on the call. Councilwoman, are you there? Do you have something you wanted to share? Councilwoman Lanier? I may be missing you. I'm sorry. All right. Next up then is Mr. Mutamba. Are you in on the call?
Hi, this is Ms. Mutamba.
Okay. Oh, sorry. Hello.
Hi. Yeah, I don't have anything else to add. I'm just available for any questions that might come up regarding the policy that Mr. Shields just spoke about.
Okay. Does anyone have any questions for Ms. Mutamba or for Mr. Shields? All right, and then one last speaker, Ms. Tinsel, are you in on the call?
Yes, I am. Thank you, Ms. Marianne.
Wonderful.
Good evening. Good evening, everyone. My name is Althea Pamzo, and I'm the ICS Commander of Logistics. And now that the hurricane season is ended, we're still left to handle the spike in COVID cases. I want to reiterate our efforts to stay ahead of the curve continues. Please refrain from the gatherings, as you heard Chief Curd and our city manager reiterate. Also, wear your mask, avoid large gatherings, and continue to sanitize. I know for me personally, it's going to be a difficult time to not be able to be with family and friends, but we're really going to have to refrain for that. I think we've done a good job of keeping the numbers within a reasonable aspect, so we would like to continue that. Though our teams are planning to continue food and mask distribution, as a result, and as the logistics officer, I'll continue to monitor our inventory levels, and they remain steady now. Our usage rates did slow down since we have fewer masks distribution, but we shall move back to having higher inventory levels within the next couple of weeks, so we'll hover around 80 to 100,000 so that when they're ready to do the mass distributions, we are ready. We would like to also see if we could source one packet with the mask and the hand sanitizer in one packet. Hopefully we'll be successful in doing that. If not, we will still at least have the masks available, because now we're running into some supply shortages and it's taking longer to get off the manufacturing line. And that's all I have to share. That concludes my report. I turn it over to you, Ms. Dozier.
Thank you, Ms. Simpson. I appreciate your report. And that concludes all of the reports from staff and the leadership team. Councilwoman Lanier?
Yes, ma'am.
All right, there you are. I was just wondering if you had any questions for anyone, or if Councilwoman Botell had any questions for anyone.
Yeah.
Or if y'all had something y'all wanted to. Go ahead.
I'm sorry. No, I just wanted, when I came in and heard Ms. Grimsley talking about the testing, I just wanted her to kind of repeat that information for me, because it was kind of going in and out and I couldn't really hear her.
Okay. Ms. Valerie, you still on the line?
Yes, ma'am.
Okay. Regarding
yes, regarding the testing at this time has been set up at Wells Recreation through United Clinical Laboratories. It is by way, the PCR test is the throat swab. It is for the community at large. It's going to be held, or currently being held, on Mondays and Wednesdays from 9 to 4, and on Fridays from 1 to 5. It will continue through December, and this is due to the CARES Act, but there's some work that's going on in the background to try to get some additional dollars so that we can continue the testing for the community through January. Testing results are provided within 24 to 48 hours, sometimes 72 hours, just depending on the load in the lab. And results are provided to any citizens, including our employees, by phone, email, and text.
Okay, if there is, do you have any flyers that reflect that, Ms. Grimsley?
Yes, ma'am. We do.
All right.
Would you like me to send you one or drop off some to your office?
Yeah, no, just send me a copy so that I can share it with the public to be able to know that we do have the testing at Jay's Ministry on Tuesdays and Thursdays from, we have additional testing at Wells, and that is very good information for the public.
Okay, no problem. I'll make sure you get that tonight.
Valerie, if you have that flyer, send it to all council people. So we all have.
I'll make sure it's done tonight.
Great, thank you.
And send me a copy.
Okay.
All right.
I just have
anything from anyone else? Any questions from anyone? Any other comments from anyone?
I have one announcement. Can you hear me?
Yes.
Okay, this is Councilwoman Botel. I want to remind people that we have our All Things Marine webinar on December 8th at 6 o'clock. I'll be putting out a flyer. I just put out a flyer on it on Facebook and on Nextdoor. And if you don't get on either of those social media platforms, you can email Sam Brown at st as in Thomas Brown at rivierbeach.org for information on how to access that webinar on Tuesday. I already mentioned that we're up for an award with Hats Off. It's called the Hats Off Award, and it's from the group called Nonprofits First, and that'll be also on Tuesday. I'll be multitasking. And I also wanted to say that the Friends of the Riviera Beach Schools is collecting money to provide Christmas for Stony Brook children. We've asked the children at Stony Brook to write letters to Santa, and we'll be getting them the gifts that they've asked for, and also sending other students in the city at Lincoln, Washington, and other elementaries, Bethune, to places for the holiday field trips. If you are interested in providing funding for that, you can send money to J.B. Dixon, Dixson, at 3000 North Ocean Drive, apartment 28B, Riviera Beach, or just email stbrown@rivierbeach.org, and he can give you the details. And the Youth Recreation Association is also seeking funding for Christmas parties for Riviera Beach children, and you can send them money at Youth Recreation Association, 5003 Bernardo Lane, Riviera Beach, and their zip code is 33407. But again, if anyone is interested in providing funding for any of those projects, Sam Brown has the information. He's at stbrown@rivierbeach.org. And that's everything from me.
Thank you. Anybody else? And I did want to say, Councilwoman Botel, we did share the Fast of Your webinar in the digital newsletter that we sent today, and we also did put on the website calendar as well.
Great.
So that people will
Thank
know.
you.
And of course, you mentioned it in the print newsletter, which I was going to mention too to everyone. Mr. Evans has got back the quarterly print newsletter, and that should be coming out within the next week or so. So everyone should be getting it in the mail if you get a utility bill from the city. But if you don't receive the print newsletter, feel free to send the media team an email at citynews@rivierbeach.org and let us know that you didn't receive it and you do want to receive it. It should be coming out in the next couple of weeks. Okay, perfect. Anything else from anyone? Mr. Evans, did you want to close the meeting?
Thank you, Ms. Dozier. And again, thank you for the elected officials and your leadership with regards to the pandemic. And again, we are looking to bring forward a discussion with the board to talk about a urban farm in our community to be able to provide fresh produce to the tens and thousands of pounds. So we are working with a provider, and we're excited about that opportunity to repurpose some property that we have here in the city that can provide a sustainable resource for us for the long term. So we're excited about that. And again, more information to come with regards to a mass distribution from the city. And so we will continue to keep the community abreast of what's going on and be looking out for the newsletters that should be hitting your mailbox in the next week or so. And that concludes my comments, Ms. Dozier, and I think our call as well.